Hello and welcome to Thursday's Zoom. Those of you who have a CPT manual, I know some of you don't yet, go ahead and make sure that your manual is handy. Alexis, I know you don't have yours yet, but I did take pictures for you so that as we're talking about some things, I can show you the pictures in my slideshow. So I tried to keep everybody in mind. Don't worry about it, Angelic. I'm just glad you're here. It's okay that your work computer does not have a camera, but I appreciate you letting me know. All right, so I don't think that I can think of any announcements except that, guys, module 154 is rolling right along, isn't it? It's our longest module. It's 40 days. We're a little over halfway done. So if you need to get caught up on some things, make sure you get with me and Miss Danielle so we can help out with that. Okay. All right. So I'm going to go ahead and I'm going to share my screen. Can you guys see?
Yes, ma'am.
Okay, so we're going to be talking about chapter 17, the cardiovascular system. I don't know how many of you have gotten into the cardiovascular system yet, but it's pretty big, isn't it? When you look at the cardiovascular system as a whole, it is humongous. But let me tell you guys, I was a cardio coder for 4 years. Do you know how many of these CPT codes I used? Just a little handful of them, because unless you're going to work in a big city for a major hospital that's kind of specializes in the heart, you're not going to be using most of these. So remember, you don't have to be an expert. You just have to know how to look it up. All right. Today, we're going to put the focus on pacemakers, because here in Louisiana, for some reason, we do a whole lot of pacemakers, a whole lot of catheterizations, and a whole lot of stents. But I decided today that we were going to focus on the pacemaker. Okay, so what is a cardiologist? So if you see the medical term ologist, that simply means specialist. And then cardio means the heart. So a cardiologist is a doctor who specializes in the heart. Specializes in the treatment of conditions of the heart and may further specialize in the area of radiology, medicine, or surgery. So can a cardiologist do a surgery on your right knee? No, he can't. Can a cardiologist do a procedure of a major vein in your leg?
No.
He can.
Depends on if it's affecting the heart.
Well, yeah, it depends on, right. I should have been more specific about that, Kylie. Thank you for adding that. Yes, if it's something to do with your heart, yes. Because how many of you know that there are different ways to have heart catheterizations? They can go through your leg, they can go through your groin, they can go through your wrist, they can go through your neck. Usually, it's through the vein in the leg if it's a pretty severe. My doctors, when I was coding cardiology, the only time they went through the leg, they weren't just going to go up to the heart. They wanted to go down too to see if there were any blockages anywhere. Have you guys ever heard of, it's thrombosis, deep vein thrombosis?
Yes, ma'am.
So they're always checking for those things. So when you guys coded the, well, we haven't got to the digestive system, but we did the respiratory system. And remember, where did you start coding? You started coding as soon as they entered, right? And if they stopped here, you stopped coding here, right? So you wouldn't stop coding here if they stopped here. The same thing with the heart. You code for however far they go. So if they go up and down, guess what? You're going to have to code up and down. But we're not going to get into all of that. But those were the fun things that I did when I was a cardiology coder, is you got to see exactly where they were going to go in the body. All right, so cardiovascular coding may require codes from the radiology section of your CPT And that's your diagnostic studies. Can you guys think of something in radiology that we would use for cardiology? What about an EKG? Maybe a nuclear stress test? Those kinds of things. So medicine, non-surgical and percutaneous, that's where you're going to find what's in your medicine section. My goodness, I'm getting tongue-tied. And surgery is going to be open and percutaneous. So let's talk about invasive and non-invasive. So these are keywords you need to make note of because it's very, very important when you're coding. Invasive procedures break through the skin and are used to make a correction or examine the cardiac system. So invasive actually enters the body. So if we're doing a cardiac catheterization and they're putting a catheter in, that is invasive because we're going into your body. If you're doing an EKG, that's non-invasive because we're just going right on top, right? Let's talk about an example of an invasive procedure. Opening the chest for removal of a tumor on the heart or percutaneous placement of a catheter in an artery. Both medicine and surgery sections contain invasive procedures. Non-invasive procedures that do not break the skin, an example, an electrocardiogram. We talked about that already. So let's take a look at this. So I have a picture and I got a different one than that was in your book because you've already looked at that one probably. So I wanted to show you a different one. What I really want us to pay attention here though, is I want us to look at the valves of the heart. Did you know there are chambers of the heart? There's 4 different chambers. You have your right atrium, your left atrium, your right ventricle, and your left ventricle. You need to remember those words. Just because when you're talking about placing something in the heart, it's going to tell you ventricle, atrial. So those are kind of things you need to be familiar with. So your pacemakers are implantable defibrillators. The code range is from 33202 through 33273. And they are devices that assist the heart in electrical function. So this is not a long video, okay? But I wanted us to see how a pacemaker or a cardio defibrillator actually works. I'm going to stop sharing because I don't think that I made sure that I did share sound, and I want to make sure I do that.
Implantable pacemakers and defibrillators are devices that apply electric shocks to maintain the rhythm of the heart and, if necessary, restart it.
Oh, what did I do?
As the technology...
Sorry, guys.
Implantable pacemakers and defibrillators are devices that apply electric shocks to maintain the rhythm of the heart and, if necessary, restart it. As the technology improves and the list of treatable conditions grows, the number of devices being implanted is increasing steadily and now exceeds 500,000 a year. The heart is made up of 4 chambers, 2 atria and 2 ventricles. On each side, the atrium is connected to the ventricle by a one-way valve. Blood is pumped as these chambers contract and relax in turn. The beating of a healthy heart is regulated by electrical impulses. The sequence begins as the atria fill with deoxygenated blood from the body on the right and oxygenated blood from the lungs on the left. An electrical signal from the sinoatrial node then causes the atria to contract, forcing blood into the ventricles. The electrical signal is then picked up by the atrioventricular node and directed into the Purkinje fibers in the ventricle walls, causing the ventricles to contract. And the blood is then pumped through the pulmonary valve on the right to the lungs and the aortic valve on the left to the rest of the body. These valves...
All right, I want you to remember about the valves. You're going to see a lot about the pulmonary valve, the atrial valve. You're going to see that in your coding scenarios.
Close, and the cycle then restarts. When the sinoatrial node fails to function correctly, an artificial pacemaker can be fitted to help regulate the heartbeat with small, evenly timed electric shocks. This involves implanting electrodes into one or more of the heart's chambers by inserting leads into a vein near the collarbone and implanting a device called the generator just under the skin. For more severe heart conditions, an implantable defibrillator, or ICD, can be used, which is also capable of sensing a stopped heart and delivering an electric shock powerful enough to restart it. For some conditions, an even more sophisticated device, called a CRT ICD, can be implanted. This uses a third lead inserted into the left ventricle to resynchronize the ventricles when necessary. However, all these leads can cause problems of their own. Patients with ICDs have a 20% chance of a lead failure within 10 years, and replacing leads can require open heart surgery in about 2% of cases. This has resulted in several efforts to develop new pacemakers that do not depend on leads inside the heart. One design, the subcutaneous ICD, places the lead just outside the heart under the patient's skin. And wireless designs are now being developed that may eventually do away with the need for leads altogether.
So I'm a visual learner. To me, that made me understand so much more of how a pacemaker actually works. I can visualize that in my mind. I can visualize the heart in a simple way because I'm a simple kind of girl. So I need it broke down simply for me. But how amazing is it that we have come so far that now we're actually going to be doing away with that pacemaker. This is what I want to talk to you about. I had a case of a patient who had a pacemaker, and they put it into a pocket under the skin, that little box. He got a severe infection in that. So let me ask you, we've talked a lot about, we have globals. That means anything that happens after your surgery, if it has to do with that surgery, that they're going to pay for. You don't have to pay for that. It's the doctor's responsibility to fix it. So say that patient goes in, has the cardiac pacemaker put in, and he gets an infection in the pocket. Would that be part of a global package? Would the cardiologist be responsible for treating that?
It depends.
No, he absolutely is. If it's in that pocket,
It is.
yes. If he opened up that pocket, Amanda, and put that in there, he's responsible for whatever happens with that pocket. And that patient does not have to pay for any further treatment. Now, has to pay for his antibiotics or what have you. But if it's a hospital stay, it's all related to
Well, that's what I was saying. It depends. Like, unless the infection comes around later on,
True.
then you'd have to charge for it.
Right. It would have to be within a certain time frame. I'm going to tell you, pacemakers have a 30-day global. That's it. That's all you get. And I know because I coded those. But very seldom did we have anything go wrong. I think I saw 1 or 2 infections, and usually that was more due to hygiene than it was anything else. But I just kind of wanted to talk about that whenever the doctor does that, if there's anything that goes wrong within that 30-day period after the surgery, the doctor is responsible for treating that with no further charge to the patient. All right, so we're going to go back. This isn't going to be a long, drawn-out process, guys, I promise. I know we've been having some really long lectures lately. Okay, so in your CPT manual, you have a cheat sheet. I tabbed my cheat sheet. Now, if you have the 2022 CPT, it's on page 250. So, and this basically tells you, like, this one is an insert transvenous single lead only without a pulse generator. And you have your pacemaker and your defibrillator. So it gives you your codes here. So if you have your CPT, I would say tab your little cheat sheet so that you can refer to it anytime you see a pacemaker scenario. Okay, something else I want to tell you. Have you guys looked up pacemaker in your index yet? Not going to find it. In order to look up electrodes, any defibrillator, anything that's going to assist your heart, you have to look in the index under cardiac assist devices. So anytime it's something that's going to assist your heart in functioning, you have to look under cardiac assist devices if you're using your index. All right, so Alexis, here we go. This is just for you. I made sure we had a picture here. Hopefully y'all can see. I couldn't make it any bigger. So this is our scenario. Alan Jackson, the country singer, right? Gets very tired walking up and down the stairs. He has a hard time catching his breath and experiences instances when his heart feels as if it is beating fast. His physician has told him that he will require a pacemaker implantation. Alan goes to the surgery and he has a single lead pacemaker implanted with a ventricle lead. All right, so 33206 says insertion of a new or replacement of a permanent pacemaker with transvenous electrodes, atrial. So that one word, atrial, says we don't even need to be looking at this, right? Because we're looking for a ventricle, correct?
Mm-hmm.
Let's look at 33207. It says insertion of a new or replacement of permanent pacemaker with transvenous electrodes, ventricle. Okay, nobody answer. I'm going to read 308. Insertion of a new or replacement of a permanent pacemaker with transvenous electrodes, atrial and ventricle. Okay, now Alexis, I'm calling on you because you don't have your CPT yet, and I want you to be able to see which one of these codes do you think matches up with our single lead pacemaker with the ventricle lead?
The 207.
Who agrees? Perfect. That is, yay, Alexis just coded your first scenario without a manual. Okay. So I know this is a little glossy. I cannot help it. I can't do anything with it. So I want those of you, well, go ahead and go to CPT code 33210. It's on page 251 if you have the 2022. This is our scenario. Mary Ware is going into surgery today. Dr. Hart is going to insert a temporary pacemaker. What is your CPT code? I made it
210.
33210. I know I kind of given it to you, but I mean, I just wanted to show you, if you look over here, or you look on the other side, your 33206 for your pacemaker that we just chose, it's right here. So if you tab this that just said pacemakers, you could just go straight over to your pacemakers, right? When I talk about tabbing, Alexis, we put tabs on our manuals. They're going to come with some, and I'll help you get those put in. We can do a little zoom on that, or they're not really hard to do, but you could put a tab on it that says pacemakers and you can go straight to it, right? You can forego that index. Getting to know your CPT is so important. Putting these little tricks in for you, especially if you're a cardiac coder, right? Okay, so now, unfortunately, we're just going to map some out. And guys, I know that some of you are experienced coders, but I need for you to understand that everybody is in a different portion of their education journey. We're just going to talk about them because I find that mapping out some of these scenarios for cardiology can be tricky, okay? So, but I do want you guys that have your CPT manual, I do want you to follow along. So now I can't see what this is. It says resection, I have to move my lamp. Resection of an endocardium primary malignant tumor in which coronary pulmonary bypass is required. It sounds very, very, very complicated, doesn't it? I made it very complicated when I tried to code it. Let me just tell you, I was all over the place because I wanted to go to a resection because that's actually what we did, right? But remember, sometimes it's not what we did. If we can't find it within what we did, then we need to look at our anatomy. What part of the anatomy are we in? Heart. I went to heart. It wasn't there. You know where I found it? Under tumor. So that just teaches you, even me, I've been coding for a long time. I do not pick the right keyword every time. When you don't pick the right keyword, there's no harm, no foul. Go back and choose a different word. And then sometimes there's different ways to skin a cat. It will show you different ways to go and it'll take you to the same place. But with this scenario, we're going to go to tumor. Under tumor, we're going to see heart. And it's going to be excision, and we have to choose between 33120 through 33130. So let's turn to that section, 33120. Okay, if you're in 2022, it's page 247. Dawn, do you have it for the 2023 manual?
233.
233 for the 2023 manual. Okay, so 33120 says excision of intracardiac tumor resection with cardiopulmonary bypass. Does that match? Or do we need to continue to look?
Can you repeat that?
33120 in the CPT, that description says excision of intracardiac tumor resection with cardiopulmonary bypass.
Yes.
Excision and resection can be used interchangeably. Sometimes the words are not going to line up perfectly, but let's look a little bit further. We only can do one more code because underneath it is 33130, and that code is resection of external cardiac tumor. Was this an external tumor? No. So 33120 would have to be our code. Remember, sometimes if it's a resection or an excision, we're pulling it out. Did that make sense? Alexis, it's going to make a lot more sense when you have your manual, I promise. By next Thursday, girl. All right. So let's read our next one. I got to move my lamp again. Andrew Nielsen has a loud heart murmur. After study is found to have severe aortic stenosis. He elects to have an aortic valve replacement. He is taken to the operating room and placed on a heart-lung machine. He then has his aortic valve replaced with a prosthetic valve. Okay, so again, I went straight to replacement. I was trying to make it too simple. Did not find it in replacement. I had to go to aortic valve replacement. Remember before we had to go to tumor, right? So what it's telling me in these scenarios is a lot of times we need to go to the specific body site or the specific thing like a tumor that we're actually going to be pulling out of the heart. So we went to aortic valve replacement. We went down with our finger with prosthesis. We have 33361 through 33369 or 33405. So let's go to start with 33361. All right, so 33361 says transcatheter aortic valve replacement with prosthetic valve, percutaneous femoral artery approach. Okay. 33362. The same thing, but it's open femoral artery approach. All right. 33363 is the same thing, but the approach is open axillary artery approach. 64 is open iliac artery approach. 65 is transaortic approach. 33366 is transfacial exposure. The rest of these are add-on codes, so we can't use them, can we? And then 33345, and this is what this one says. Replacement aortic valve open with cardiopulmonary bypass with prosthetic valve other than hemograph or stentless valve. So what do we think the answer is? The only one that had anything to do with an aortic valve. Dawn, what do you think?
33405.
What do we think? Let's read the description again of 33405. Replacement. We have the word replaced. Aortic valve. We have aortic valve open with cardiopulmonary bypass. It doesn't exactly say that, but they have to bypass the cardiopulmonary artery anyway. With prosthetic valve. And what did we do? A prosthetic valve. So the answer is 33405. Great job, Dawn. Looking at that now, does it make a little more sense once we pulled those words out? Okay, I feel like I'm losing y'all. We're gonna do one more, but we're gonna code a different way. Remember we talked about, I call it the table of contents or the glossary that's before your guidelines or after your guidelines for each chapter, right? So this scenario says valvoplasty, tricuspid valve with ring insertion. Now, instead of going to the index, we're going to go to this little glossary area, and I did not put the page number on there. Hang on a minute. It's going to be page 240 in the 2022.
$226 in the 2023.
Thank you, Dawn. Okay, so we have a vulvoplasty of the tricuspid valve with the ring insertion. So here, if we start scrolling through on our finger in our little glossary, which is much shorter than our index, right? We see that this is a cardiac valve. So we know we're dealing with valves, but we're dealing with the tricuspid valve, right? So right here, it says tricuspid valve. It starts on page 262 for my manual. It'll be different for the 2023, but it's code range 33460 through 33468. So let's decide which code it is. So we're going to start with 33460, which is on page 262 for 2022.
2023, it's page 248.
Okay. So 33460 says valvectomy, tricuspid valve with cardiopulmonary bypass. But it doesn't say anything about a ring insertion, does it? All right, so let's keep looking. 33463, vulvoplasty, tricuspid valve without ring insertion. This code 33463 says without, but we need with, right? So we keep moving down. 33465 says replacement. Oh, wait a minute, I went too far. 33464 is a vulvoplasty tricuspid valve with ring insertion. Does that match our scenario? So our answer is going to be 33464. And we found this just by going to the little glossary before our surgery section or our cardio section, and it kind of gives us a breakdown of what's on the page, on each page. I know some of you prefer to code that way. I do it kind of both ways. Okay, so how are we feeling about the cardiovascular section now? Are we feeling better? Alexis, I'm not asking you how you feel without a coding manual. I'm just going to say thank you for sticking with us. We know that's a whole lot of 33659. It just seems for this long, doesn't it? But because you're listening, when you get your CPT manual and you're open it, you're going to be like, that's what they were talking about. Oh yeah, that's what she said. It's just that easy. Ladies, tell her, is it that hard when you get your manual, or does it start falling into place?
It starts falling into place.
Falling into place. Do you guys have any questions or concerns? No. Don't, Alexis, you probably got concerns all over the place, but just put them on pause. You know, you can call me if you need me, but it's going to get better when you get your manuals. Just be patient. All right. Well, thank you so much for coming and spending time with me today. I hope that you learned something, and I hope that you enjoyed class. Next Thursday at 4 o'clock, Miss Danielle will be hosting. And for Miss Marcia's students, Tuesday, 9 a.m. NCCT practice, we're going to finish up laws and ethics.
Miss Marcia, I have a question.
Okay, hon.
I am trying to work, hold on, I'm looking at it now. I don't have my CPT manual either.
Okay.
And I'm trying to complete one of my assignments, but I'm kind of using an online version, I guess, of the CPT manual, I guess for now.
You can CPT lookup. Alexis, you can get a CPT lookup app on your phone.
Okay. I think that's what I'm been using too, actually. But I'm trying to, it's asking me to code different cardiovascular, I guess, codes. And whenever they, I guess what I'm trying to say is, hold on, let me pull you back a bit. I guess so what I'm trying to ask is it always going to be in like definition, the codes? Like, is it going to say exactly what, or do I have to piece them together? I'm going to have to piece. Okay. That's what I was thinking. I was trying to look for it online, and then it was, I don't know, the ones I have on this assignment are a little different. They have a lot of, I guess, extra things to it. So I can't figure out which code, like navigating through the codes, which one should I use, or is it going to be multiple? I don't know. I guess without my
Okay.
book, it's kind of
The,
hard.
the way that you know if it's multiple not in your book is if it has 2 blanks. If it has 2 blanks, you need more than one code. And
Okay.
if it just has 1 blank, you need 1. And also, if you look at the bottom of your exercise, it'll say Appendix C. Go check your answers if you're unsure. Like if you're unsure, I'm not telling you to cheat. I'm
Okay.
not telling you to cheat. What I'm telling you is even I call it coding backwards. Sometimes I have to look at the answer and go back to my CPT and find out why that's the answer. I learn more that way sometimes than I just do blind coding. I can't get everything right all the time. None of us can. Absolutely. You're never going to get a code right every single time. So being able to look at your answer and then go back and find out why that's the answer, it means that next time when you come up with a scenario that's similar, you're gonna recall, okay, that's why that they did that time, and so I need to do that this time. And if you remember on our examples, we had a resection, but in our CPT manual it said excision. Sometimes they use words interchangeably, but the major parts were the same.
Okay.
With or without. If something is a with or ring, make sure that you're putting with or ring. If it says without, make sure it's without. If you the numbers that go higher, like the with or ring, if you looked at the CPT code, it's higher, which means it's more money.
Okay.
But you can never, if you go over what you're supposed to code, it's called upcoding and it's against the law. You get in trouble for that. But you don't have to, you don't have to worry about that. But I'm just saying that's what it's called. But piece it together and remember, we don't learn anything if we get everything right. If you get a wrong answer, it's okay. We learn when we get it wrong. We don't get this instructor, we celebrate wrong answers because it's an opportunity to learn, right? Miss Danielle's the same way. So, and if you have some that you're having issues with, text Miss Danielle which ones those are. We'll add them to our Zoom call next week and we will go over them. But you have to let us listen. Don't spring us on us in class because that's where my mind goes. Let us know ahead of time, and that way we can map it out and explain it. It takes a little time to map it out and say, okay, in your index, we're going to go here, and then we're going to go here, and this is why. So don't put so much pressure on yourself. Relax into it. And sometimes, Kylie, I call Miss Danielle and say, I cannot find the CPT code, help me. And because we talk about it, just like that. How many times do I get on with the student and they can't find it? And as soon as they start talking to me, they're like, I just found it. Try not to overthink. If you begin to overthink, walk away, clear your mind, come back.
Okay. Yeah, because that's how it's been. It's like, oh, it could be this one, or no, never mind, it could be that one. So it's especially when having the book.
Yeah,
Okay.
well, just stop putting so much pressure on yourself. You don't have a CPT manual right now. So
Okay.
just do the very best you can, which is really getting to know, reading the scenarios and just kind of thinking about them and trying the codes. You're okay. You're not going to be responsible for an exam or anything like that. So just enjoy this beginning process, because the other ladies can tell you pretty soon you're going to be more experienced. And that's when you feel more pressure, because it's like, I should know this. And you really shouldn't, because we all learn every day, right? So, all right, ladies, well, I'm going to let you go. Kylie, anybody make notes if you have questions, let us know ahead of time. We'll go over it next week in class. And if you need time on a Zoom personally with me or Miss Danielle, just schedule it with us.
Okay. Thank you.
Thank you, guys. Have a good evening.
Thank you. You too.